Okay, I see it's 2 minutes past the hour. And just for the interest of time, I know we've had 143 people register for the webinar, so we're really excited, and I assume people will join as we go along. But if you guys are okay, can we start and people will join in as they can? Is that okay?
I think so.
Yeah, good. Okay.
Rose, Shimoni.
Okay, so we see Rabana. Oh, there we go. She's muted. Okay, so good afternoon, everyone. Good morning, wherever you are. I think I can still say Happy New Year. I've decided that I'm going to say Happy New Year until the end of the month. So Happy New Year, and a very, very warm welcome to everyone joining in today. It's my pleasure to welcome you to CommonAge's first webinar for 2026. And a particularly significant one for us. It's the first time that we are hosting a platform where you will hear directly from our country chapter heads across Africa, sharing their lived experiences, their insights, and their priorities. Today's webinar is inviting us to explore the diversity of the aging experience in Sub-Saharan Africa across the 6 countries. While we are united in our shared values and common vision, we know that aging looks different in different countries and in different contexts. Our hope is that this conversation will spark deeper collaboration, mutual support, learning, and growth across our chapters. So just some housekeeping and some Zoom etiquette. Before we begin, just some quick guidelines to guide our session. As we start, please keep your microphones and cameras switched off throughout the presentations. Not now, just now. Our speakers are kindly requested to keep to the allotted 10 minutes each to make sure that we can hear from all the different country chapters. I'm also requesting that if there are any questions or comments that you have, please put those into the chat box. As you listen, if we have additional time at the end, we'll go through those questions, but we will also send some responses to the questions via email after the webinar if we run out of time. So before we kick off into the first presentation, can I ask, for those who can, if you can put on your cameras so that we can take a picture? Iris will kill me if I don't do this. So if you could put on your camera just for 1 minute, and she can take a quick picture. Oh, there you go, Andrew. I always find it fascinating across to see people from across the world with different types of clothing depending on the weather. We are melting in Durban at the moment. Okay, Iris, are you ready to take a picture?
I am.
Okay, so big
smile,
everyone. Here you go.
Got it.
Thank you. All right, thank you. So we'll switch off our cameras now and mute. So today's webinar is not just about sharing the challenges and best practices, but it's also about building pathways for collaboration across our region. I encourage you to listen with curiosity and openness, and to think about how we might support each other beyond today's session. That for me is very important. This should not just be a once-off engagement, but look for opportunities for you to collaborate beyond this webinar. If you are interested in becoming a member of CommonAge, we would love to hear from you. Please feel free to send a direct message to Renita in the chat box, and she will gladly follow up with you. I would also like to sincerely acknowledge everyone who has worked behind the scenes to make this webinar possible, including our colleagues who are providing technical support today. Your efforts are deeply appreciated and fully aligned with the vision of CommonAge. Our vision is clear: to work towards an all-age-friendly Commonwealth, rooted in the shared values and aspirations that are captured in the roadmap to aging well. The link to the roadmap will be in our chat box, so if you would like to get a copy of that, just look through the chat box. We'll put in the link. And I encourage you to have a look at that and look for pathways for collaboration within that document. With that, it is my pleasure to officially open the session, and we look forward to a rich and meaningful exchange over the next 80 odd minutes. Thank you for being part of today's conversation. So I now hand over to our first speaker, who is Megan from Botswana. We've put it in alphabetical order, just in case anyone's curious. Okay, Megan, are you okay?
Yes, hello everyone. Thank you for coming. I'm the first presenter is Botswana Chair. My co-chair, Dr. Batisi, is also in attendance, and she will also help in responding to questions after my presentation. So with regards health and active aging, in the Botswana chapter has done quite a lot, and we are pleased to share some of the things that we've done. I'm going to start, for those who don't know Botswana, I think I'll introduce where it is. May you move on to the next slide. Botswana is has 4 neighboring countries: Zambia in the north, Zimbabwe in the east, Namibia in the west, and South Africa in the south. So we are sandwiched by those good countries. So my presentation is going to start with the introduction, then advances on aging in Botswana, opportunities for collaboration and the collaborations we already have in place, and the basic practices that we come across and take part in is Botswana. And then we have listed a few plans for 2026. So as we all know, this is about health and active aging. And we all know that that encompasses the social, the physical, and the psychological. So by 2030, 1 in 6 people will be over 60. You're rushing too much.
I'm sorry.
Yes. So
okay
then
now?
by
Yeah.
2050, the number of older people will have doubled. Then 2/3 of the population will be over 60 in LMICs, low to middle income countries. And this is by who? 2025. If you look at the 3 diagrams, that's how the older people are aging. In 2005, you can tell there were more children and more people in middle adulthood than older people. Then in 2016, the graph is widening as we get to older people. Then in 2030, you see it's almost similar. The number of older people is almost similar to younger people and people in middle adulthood. Next slide, please. So I wanted to share with you our results for the E-STEPS survey. As we all know that for us to implement or to look at what we need to do with regards aging, we need to have statistics. We can't do that without knowing the prevalence of risk factors of aging. So Botswana did a survey called E-STEPS survey, where we were testing how many people had hypertension, how many had diabetes, obesity, and this was done in 2014 and then in 2024. So if you see at that, if you look at that table, I was trying to compare the prevalence for 2014 and the prevalence for 2024. It's quite concerning that despite the efforts, meaning the efforts are not enough, if you look at those percentages, they've all increased. This is this is a 10-year gap. So you look at overweight individuals, and by the way, more women are more overweight than the males. So it moved from 32.9% to 47.1%. This was a national survey. And then obesity, 12.4 to 22, hypertension 31 to 39.6, then estimated stroke risk 9.6 to 16, then percentage of people who ate less than 5 servings of fruit and vegetables 89.4 to 92. 92.3. Then percentage with insufficient physical activity 14.1% to 17.5. Here I want to add that Botswana people are exercise fanatics. Those guys exercise. They go up mountains during weekends. They take walks, they do marathons. So I think this percentage is lower. I was actually comparing our results with Eswatini. Eswatini did exactly the same survey, but they didn't have a comparison. I think 2024 was the first year they did this survey. This survey was initiated by WHO. So we also looked at physical activity, then percentage with diabetes, 3.1 to 4.7, and then percentage with depressive disorders. However, I would want to explain that these are called depressive disorders, but us as psychologists, we call them depressive symptoms because we didn't test them clinically. We just screened for depressive symptoms. But this is how it's put in the report, which is something I'll ask them to correct because these are preliminary results. Let's move on to the next table for prevalence. Then this is a continuation. So this page is disaggregated data by gender. So men had higher rates of tobacco use and alcohol consumption than women. You see the percentages. However, women experience the most rapid rise in metabolic risk factors as shown in the table below. Prevalence of overweight women, 45 to 59, obesity, 19 to 31, hypertension, 29 to 41, and estimated risk factors, 11.1 to 18.5. Notably, risk factor for women nearly doubled compared to men. I think some of us here, we also fall in this bracket, so we need to do something about it. Next slide, please. So after sharing my results, I look at all of us and want us to come up with implementation. So as I speak, as a researcher, we've actually moved away from just looking for results or looking for what we all know now that diabetes is a risk factor for aging. And what are we doing about it? So as people in that field, we are now looking at how we apply. We are now looking at implementation science. So we no longer even look at associations, causes and what, because we know that. But now it's the how. How are we going to reduce the increment of diabetes, hypertension, blah, 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 blah. And this is done through collaborations and through research, where we are going to test medication. We also test, we screen. After screening, we medicate, we use psychotherapy, usually CBT, cognitive-based therapy. Then we also check it adherence, those who know their status, are they taking medication, compliance. And we also look at awareness and education. So the collaborators we work with in Botswana, there's Botswana University of Maryland Medical School Initiatives, BUMI. It's based here in Botswana at the University of Botswana, and we also work with the University of Botswana. Then also Aga Khan University in Kenya. We have certain professors who participate in implementation science with us. then University of Maryland, Baltimore, Ministry of Health, and other line ministries, and also NGOs. You'll see some of them as we go. So all these collaborations are aimed at enhancing research capacity and public health initiatives.
Sorry, Megan, Megan, we have a minute now.
Okay, next slide. Okay, this is just an example of ongoing projects, the Be Smart project and the Raise Botswana project. I think people will be more interested in the Raise Botswana project, the interplay between aging, Alzheimer's diseases, and social determinants of health. And these strive to provide insights that will inform policies and healthy aging. All these projects are implementation science. So we are looking at the medication that can work and the intervention strategies. Next slide. Those are the other projects that we are working on. These ones we are still awaiting grant funding, but they all look at stroke in older people. The other one is on mental health, and the other one is on be abstain through to abstain from substance use and misuse. Next slide. So these are the civil society collaborators we work with. You see all the logos there. I won't go into detail to explain them because of time, but some of you are here attending, so you know who we collaborate with. Next slide. Best practices. These are previous best practices. I can't explain all of them one by one. The first one was celebration of Older People's Day. The next one was screening on non-communicable diseases. The third one was on Brain Health Week, and people were talking about dementias, blah, 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 blah. The same applies to these. All these are best practices. The first one was on diabetes awareness. The one in purple was on epilepsy. That other one, you all know, this is from the conference at IFA in Cape Town. The one below that was the triad of health, where there are old ladies in white. The triad of health, which means the mind, body, and environment, how they interact to improve well-being and quality of life for older people. The last one was also an event celebrating older people. Next slide. That one, implementation of research findings, Ministry of Health and WHO initiatives. All these were launched by the Ministry of Health. So Botswana Health and Active Aging Program Strategy, then the launch of integrated care for older people, the one in the center. This one is for screening non-communicable diseases among older people in Botswana. So it's a national thing that is going on. I think they are hindered by finances, but they are trying to screen all older people with regards to non-communicable diseases. Then the last one was just a health and active aging strategy meeting where people were coming up with a policy for older people in Botswana. So they've already done a draft and it's awaiting to be sent to Senate. The draft on older people's policy. Next slide, please. I'm almost done. Femanda, this is the last one.
Okay. Last one. Okay, thank you.
Yeah, intergenerational support and inclusion. So the difference with our organization, Ageless, is that we work with the youth. So we have ageless youth and ageless elders. So they work together in collaboration. As you know, the kids are active and they also help with accessing resources, promoting education, and intervention strategies. Next slide. Key lessons from previous events. Community engagement, screening rates should increase, medication adherence, awareness, and psychoeducation. So this is basically what we are doing in Botswana. So yeah, go on to the next slide so that people can just read for themselves. So civil society collaborators. So that's all I have to say with regards Botswana. Sorry, I'm a teacher, so I talk a lot. Yeah, so strengthening partnerships. This is some of the things that you can do in selected events for 2026. There they are. We are going to be doing some of those events. Thank you for listening.
Thank you, Megan.
Yeah.
Thank you. I think there's fantastic work being done in Botswana, and I feel really bad that I had to rush you through that because I'm so interested in understanding some of the programs that you have, and I hope others are equally interested to reach out to you and get a little bit more information on the programs you are running. Sorry, before we move on to the next speaker, which is Richard from Kenya, can I just ask Anderson if you could please mute and switch off your camera just so that it helps with the connectivity? Thank you. Thank you, Anderson. So it now gives me great pleasure to hand you over to the chapter head for Kenya, Richard, and he will be, I think, co-presenting with Maggie. Welcome, Richard.
Thank you, Femada. And thank you everyone for being here. We say good morning, good afternoon, good evening, wherever you're joining from. As Femada has said, I'll be representing CommonAge Kenya chapter with my deputy chair, Margaret Njagi, who is in attendance. If there are questions, we'll assist one another to address the questions. And we are not just the two of us here. There are a great many others in the audience representing the healthy aging team in Kenya who are working together with the chapter team in their individual organizations. So let's look at a brief introduction about healthy aging in Kenya. Kenya, like most other countries, especially in Africa, is in the upward trend, experiencing a steady increase in the population of older persons. By 2024, up to about 1.5 males and 1.8 females were aged 60 years and above. That's about 3.3 million of the total population of Kenya. And the healthy aging is a public health and constitutional obligation for the country. And therefore, that calls for an urgent coordinated action across the health and social systems by the government. So as a result, the government has played its part. They have put in place policy and institutional foundations. What are some of these policy issues that have been put in place? The first one there is the National Policy on Older Persons and Aging, the 2014 version. And they have also got the Kenya Health Policy, the 2014 to 2030. There's also the Health Acts, and the aging unit has been set up in the ministry, Line Ministry for Health, Ministry of Health, specifically to deal with aging issues. And of course, we have most recently the universal health coverage system that the government has piloted in 2 counties out of the 47. And the government has a policy that has worked for some years now of disbursing cash transfers to persons aged 70 years and above. They call it Inua Jamii. That's a Swahili phrase that means lifting up the community. So 2,000 bob every month for older persons aged 70 years and above to assist their upkeep. Those are some of the initiatives the government has put in place. What are some progress steps that the government has taken? Some positive progress. These ones are important because it's what CommonAge Kenya chapter is building on to drive its agenda. The first one there is the commitment to the UN Decade of Healthy Aging. The 2021 to 2030 Decade of Healthy Aging, Kenya is part of the signatory and is working along. We, as focusing on SDG number 3, well-being of older persons, we are happy that the government is committed to that extent. There's also engagement with regional and global aging frameworks in Africa and other parts of the world. Kenya is working together with the rest of the world to address, indeed, to recognize the needs of older persons. There's also increasing civil society and private sector involvement. The civil society is taking the front role, a lot of advocacy work, and it is good to note that the private sector is coming in even to partner with the civil society. And that is something good for the healthy aging conversation, because the needs of older persons are getting addressed better than before. Strong cultural traditions of older or elder and community care. We have had a case or situations where in most cases older persons were only cared for by family members. But now, because there is a traffic moving from rural areas to urban areas, the older persons are finding themselves lonely in the community. And that is being addressed both by the civil society. CommonAge Kenya chapter is focusing on that to find who can provide service, caregiving service, for instance, that will address the needs of such lonely older persons in the rural area. So those are some positive steps that we are stepping on, or we are taking advantage of, to drive the agenda of healthy aging through CommonAge Kenya chapter. Next slide, please. Key health systems, challenges. Well, I almost removed that word challenges when I was preparing this slide, but I decided to leave it because indeed there are challenges. But we want to look at them more as opportunities rather than just challenges. They pose an opportunity for those in the healthy aging space to see what can be done to turn them around. So what are some of them? Number one, there's no standalone national health policy for older persons. This is largely because Kenya as a country has not had its bill on older persons through the parliament. We have one that was taken there in 2024. It is in progress, but it's not out yet. And as a result, policies and guidelines that will depend on such a bill are still lacking. The next challenge is limited geriatric training and expertise, especially at the ground level, at the primary community level. This, unfortunately, has gone to the higher levels of learning institutions. Geriatrics as a subject or a training is least attractive at university levels. Students are not keen on it. And as a result, that has left the aging community vulnerable, exposed. Another challenge is the fragmented and disease-focused health services. You walk into a treating center and everybody walks in to one doctor's room with their various problems. There is no specific dedicated doctor to deal with aging issues. And these are fragmented, and that is not helping the older persons much. Finally, we observed high out-of-pocket costs for chronic and long-term care. It's expensive. And the older persons, most of them out of income, cannot afford that. And that poses a challenge for them. And as we say, those are opportunities that together with the community, we are working to address those challenges and turning them into opportunities. Social and structural barriers. Ageism is one of them. This is common in most places. That is common within systems and communities. You walk to a hospital, as I said, there are no designated doctors to see older persons. Structures, buildings they are not age-friendly, like having barriers to pull along wheelchairs and stuff like that. And that is working against the older persons. There's also limited age disaggregated data. I listened to my friend Megan from Botswana, and of course, as a teacher, that would not have missed in her presentation. The data was enormous there. But here in Kenya, we don't have that data. And that data is what informs the actions that the system should take. So there is a gap there. We need to have more data to be able to inform implementation. There's also poverty and isolation and mental health concerns. Kenya is not an exception in increasing levels of dementia. And so because of poor economic status of older persons, they are not able to address this situation even at an early stage. Digital exclusion and climate-related shocks. Right from the basic use of a phone, an older person is not as adept as a younger person. And then when you go to community committees, for instance, where climate action is discussed, the older persons are excluded. And that is a barrier to the older people that we are working to address to make sure that older persons are also included in such committees. Next slide, please. Strategic priorities. These are our key areas where we feel we can collaborate, we can work together with our partners. Integrated healthy aging, or integrating healthy aging into primary and community health systems. That is important. It will start by training the right people, the right nurses, the right doctors, and then lifting it up from the community level to the national level. Establish age-friendly health services and infrastructure. Like we already mentioned, there's a gap. So we're working with the government and interested stakeholders to address that. We also need to develop a national geriatric center of excellence. We're looking at how can a county like Nairobi, which is a city county, develop one that can now become replicated in the rest of the country. Kenya has 47 counties. And so that is a conversation we've started as CommonAge with Nairobi City Government, and we are looking forward to developing something and strengthening mental health and psychological support.
Richard, sorry, oh, there we go. Concluding comments, right? Perfect.
Yes,
thank you.
Less than a minute, Femada. In conclusion, we are saying that Kenya has laid a strong foundation for healthy aging. The presentation I've done in less than 10 minutes is just a summary of the key things that Kenya has done. There are many more, but there are still implementation gaps that remain. So healthy aging must be embedded in national reforms, and investment in systems, workforce, data, and innovation is critical. And the time is now to do that. So for our friends who are listening, join us and let's have this conversation translated into action and to improve healthy aging in Kenya. Thank you.
Thank you, Richard. Thank you for that wonderful presentation. Just a reminder to all the participants, if there's any questions you have or anything you'd like further information on, please remember to drop it in the chat box. And if we have some time afterwards, we can address them. But I think as Richard spoke, the universality of the issues is coming across quite strongly. It may come packaged differently in different countries, but it's universal challenges. And that presents itself an opportunity for us to work and collaborate together. And collaborating to a different country now, we're moving over to Mozambique. And I invite the chapter head of Mozambique, Miguel, to present, Maringula, to present on what's happening in his country. And Miguel, as the country chapter head, I welcome you.
Thank you very much. Can you guys hear me very well?
Yes, we can. Welcome.
Thank you. Well, I will try to be as short as possible. First, to say that in Mozambique, we are going through a very critical moment now. The country, half of the country is flooded. There is no roads. About 800,000 of people are in a critical situation due to their houses and infrastructures have been destroyed by floods during the last 3 weeks of heavy rains. So, and in this, about 220,000 elderly people are living in critical conditions, of which about 70,000 are in our neighborhood in Maputo province. So we have been busy working on this to assist and provide healthcare services and emergencies services for these people in this situation. So going to my presentation today, I will talk about the challenges of elderly population in Mozambique, the trends and perspectives or solutions. First of all, to say that we have mapped all of organizations working in aging in Mozambique, because healthy aging is a dream still in Mozambique. There is not much done by the government. There is not much done by most of NGOs acting in the elderly care in Mozambique. So we are like starting this challenge altogether. Our dream was to establish our first conference this year on aging, and we are still working towards that. I will talk about demographic and growth of elderly population and the main challenges, and then the perspectives of solutions that we have found in this work. Next slide, please. Well, I have done already my introduction, sharing the situation in Mozambique. So we would like to highlight the demographic growth to say that this year we are going to about 35 to 36 million population. And this drives us to about 1.6 million of older people, who are about 4% among the general population. To say that the majority of Mozambicans are young, but still there are about 1.6 million of older people. But this small population, as stated by the government, makes it ignored by the system. The country is not investing much in aging. And that is a problem for us who are active in these issues of elderly care and elderly protection. Can we go forward, please? What are the main challenges in Mozambique for us? The first main challenge, can you go to the next, is poverty and insufficient social protection. Mozambique has one basic social subsidy program, which is limited, and more than half, about 32% of elderly people have access to this. And most of them never get the benefits in time, which has a very critical impact on their lives. There are regional disparities. Maputo is one of the most big concentration of elderly people. But when we go to the rural areas, the situation is more complex. So there is serious challenges in providing basic social subsidy program, which is the only social protection approved by the government. So we as a private entity and local NGOs are negotiating. We just signed a memorandum with the Minister of Women and Gender and Social Affairs to see how can we work together to find better ways. To the next slide, please. There is also restricted access to healthcare. When we look around Mozambique, only the public services are very poor. The system is very weak, and the elderly people are the most neglected in Mozambique. Our healthcare unit is the only one in the country that has geriatric care within the whole of Mozambique. There is no other university or healthcare entity that is taking care on geriatric services. So we would like to expand these services to other organizations and companies and hospitals, public and private, to provide access to healthcare for free. And our institution has started last year to provide free healthcare services for elderly people in our neighborhood. So the rural area, I can't even say anything. There is huge social exclusion, stigma, and violence. Mostly abuse, neglect, and social exclusion has been one of the most challenging issues. About 70% of people who contacted our services have been requesting legal protection as well, because there are people who accuse elderly people as witchcraft and they are stigmatized and neglected by their families without any assistance. And there is no any legal assistance about that. Although by law, it is a crime, but there is nothing that people can do. Even if you go to the police station, they will just say, go and sit down and talk about the problem within the family. So as an organization, we need to strengthen infrastructure to provide services to this group. Next stage. Well, this is the repetition of the economic frustration associated to poverty. So I would jump this one. What kind of solutions do we think we can provide to this? I think we need to expand and universalize the basic social protection service, as well as strengthen the regulations and the registration system in our database. As our colleague from Kenya was saying, we are also lacking database. It would be good if we could start a statistic research to produce a database on what is the situation of the elderly care in terms of social protection and welfare. We would like to establish mobile and community-based healthcare service, which we started already as MSB, but it would be good if it would be available countrywide, because it's only in Maputo and in Matola city. So we need to expand. We need to introduce microcredit and social entrepreneurship for elders. That would be a way to foster financial autonomy to the elders. And also to introduce tax incentives and subsidies for families caring for elderly people, because there are many people who are being taken care by younger children or younger women, but they can't get resources to get any other way to assist them besides selling on the streets or other ways of income generation. So my conclusion is, next slide, please, is that the population in Mozambique is growing as well as in the world. There is this limited social services and social protection, and we need effective solutions that requires intersectoral and sustainable approaches. MSB as a company, a philanthropic company, alone cannot do much. We need to get connected with the government institutions and the other international organizations. And funding is lacking. There is not much money. And we drive 30% of our income to sponsor healthcare and social protection to the elderly people. We hired a lawyer to our office to provide legal protection to the elderly who look for our services for free. But still is a challenge when it comes to finance all of these services without any other political or government engagement. So our next step is to get more close to the government so that we can build up a good bridge to provide institutional care to the elderly people. Thank you very much to everybody, and sorry for taking 2 minutes more.
No, you actually did quite well, Miguel. Thank you so much. Such an interesting presentation and such nuggets from that in terms of potential collaboration, especially around supporting older people during climate issues and disasters, but the need for data. And the one that really resonates is providing opportunities for older people to be engaged in the economy. People are living longer, so they need to have access to the economy to survive. So I think, you've really planted some seeds in terms of things that we should be thinking about so that we create an enabling environment for older persons and ensure that, it's a commonwealth for all ages. So thank you so much. We now move to the next presentation. And if I'm not mistaken, it's the second smallest country, Namibia. So I hand over to Janet. Welcome, Janet.
Thank you so much. Good afternoon, good morning, good evening, wherever we are. And thank you so much for the introduction. I'm making use of my phone because my internet in the office is not working. Yeah, let me start by also sending my empathy towards the Mozambique team for the disaster that they are facing right now. We are with you. We feel the pain and we feel so sorry for the difficulties that our elderly people are especially going through. We wish you all the strength. Yeah, so to start off with the situation analysis, I'm calling it a situation analysis of the Namibian chapter CommonAge. The next slide, please. The next slide is just now in the context of Namibia. It's a big country, the second least populated, but quite big. It looks so small on the map, on the African map, but it is much, much bigger if you look at the size of 800,000 square meters that our country, size of the country is, with the only population of 3 million and quite diverse. We've got 11 different ethnic groups and a lot of languages that is being spoken. So why we've got a very small population is almost 90% of the country is just desert. I also need to mention that we have a colonial history, having been under South African colonial rule, German colonial rule, and we also the country with the first genocide. And this is part of the context that we need to understand aging in the Namibian context. The next slide, please. So this slide is speaking about some demographics on aging in Namibia specifically. 6.8% of the population is above the age of 60 years and 1.3% of the population is older than 80 years. It looks so small, but if we look at the numbers compared to in the global north, it's much more people that we see is reaching the age of 60 and 80 years. Then looking at the gender disparities, more female are reaching the age of older, 51.2%, and 48.8% of the male population are older in the Namibian context. Now, most of the older people are found in situated in rural areas, but we've also seen in the latest census data that the number of older people living in urban areas have also increased, and that is also affecting, giving them some challenges, specific challenges being in the urban areas and living in isolation, far from support that they would need. This slide is just looking at the legislative policy framework. I'll summarize, and I'm not going to read it, but the Namibian constitution makes special provision on older persons. And then our Namibian government has committed itself to sign international frameworks on aging, plan of action on aging, but as well as the African AU plan of action on aging. But looking at legislation or policy in the Namibian context, we are not actually performing that well in the Namibian context concerning the policy on aging. We've got a draft policy on aging of 2022, but it has not yet been enacted. And we also have very old legislation on aging, which is still in the age of colonial era. Next slide, please. So this slide is going to look at what are the support structures available for older people in Namibia. We've got a government ministry providing social grant, but also providing counseling services and other forms of relief to older persons. And the next slide, please. Non-governmental support is quite limited for older persons. We see that more governmental support is available, but because of the size of the country, non-governmental organizations would not survive and thrive. And we see that few welfare organizations have been registered. There's some associations for older persons and also some church initiatives that is providing feeding schemes or psychosocial support to older persons, but it's really a very, very limited initiatives that one would say is happening in the Namibian context. The next slide, please. I'm now sharing the living arrangements of older persons. We know the African context of most of the older people are living in family settings in the community, but because of the legacy of colonialism, we'll also find some older persons living in formal structures. The very, very small percentage of older persons that are accommodated in formal structures, and these formal housing structures are not accessible to the majority of older persons in Namibia. The the usual housing settings that we find our older people find themselves in is in traditional housing dwellings, and some are also living in informal housing structures with limited access to water, electricity, sanitation, and living as an older person with poor access to electricity, water, and sanitation is also bringing about some challenges for older persons. The next slide, please. Looking at the health care systems for older persons in Namibia, the Namibian government provides free state health care services to the older persons. As long as you reach the age of 60, healthcare services, they don't pay any fees for accessing healthcare. However, the quality of the healthcare, as well as the long distances that older people need to travel to reach the healthcare facilities, is a challenge. Then also, the number of older people sitting in that specific queue, where they need to be supported fast or speedily, is also quite long, because there's a lot of older people in need of health care. So that speedily health care or shorter queue doesn't always work. We've got, as it has been the case mentioned by my colleagues in Kenya and in Botswana, limited number of people specializing in geriatric care or gerontology, as well as also limited number of people who get training in geriatrics or gerontology. Next slide, please. Economically, our older persons receives a non-contributory pension from the government of South African currency 1,600. And it is bringing some relief, because there's high poverty levels in our communities. But the challenge is that this pension is also then shared amongst the other members in the household or in the family, because of the high unemployment rate. Older people are struggling with food insecurity. And I also need to mention the 90% of area that is just drought, meaning that many of our older people cannot even cultivate and produce food and rely on buying in the shops. The next slide, please. I've started with some possible solutions, best practices. We are a very small country in number of population, but big in size. And as we've only joined CommonAge last year, September, the solutions and best practices, I would say, is probably fragmented. There's a lot that is happening on healthy aging, but it's small initiatives that is being done by some organizations, but there's no coordinated effort. But I want to mention the solutions. Best practices is the old age pension, which needs to be adjusted or amended to ensure that people can survive. The draft policy on older persons of 2022 is ready, and it has been aligned with the international framework on aging. But if it's not yet enacted, we are struggling to really reach out and service our older persons. Another best practice is a research on family caregiving that has been done in 4 countries, South Africa, Namibia, Botswana, Malawi. These findings would also be meaningful for CommonAge and all the other African countries, I believe, but also the need for more research. I also need to mention the small initiatives like active healthy aging initiatives, Elder Abuse Awareness Day, International Day of Older Persons as days that we commemorate. But the next slide is, I've changed the challenges. I want to end with the challenges, because as much as we have these solutions. There's still a lot that we need to do. There's still a lot that needs to be done with regards to the policy framework, long-term care, the competencies, the need for competent professionals that provides services to our older people, the need to respond to disasters like drought and floods, as it has been the case in Mozambique, but also the food insecurity struggles that we experience. In conclusion, I would then say that as CommonAge is really offering us an opportunity to benchmark with other countries, to learn from one another, to also encourage one another. And there's a long way for us. And the biggest issue for us in Namibia is probably coordination. And that is what CommonAge will offer for us. Thank you so much for listening.
Thank you, Janet. What a beautiful presentation. But I think, Janet, you raised such important issues around capacity, workforce, the training and development issues around geriatrics, gerontology. How do we build capacity? But also, I was really interested to hear you spotlight the issues around urban poverty. Very often we have this conversation around rural poverty and rural development, but we have to also acknowledge that there's increasing urbanization, and increasing urbanization brings with it its own sets of challenges. So creating a supportive environment is irrespective of whether it's rural or urban. So I was really glad to see that you brought that up. And I think, just around the cultivation and food security, perhaps that's a point where we can look at creative solutions. These are where these innovators should come up with things that helps us produce food in a very constrained environment. And maybe that's the challenge we need to put out as well. Who are the partners that can help us with that? On that note, I now thank you so much, Janet. Again, I remind, if there's any questions or comments, please put it into the chat box and we'll pick it up from there. I now hand over to Carmel and Civil, who will take us through the aging experience in South Africa. Welcome, Carmel.
Thank you, Fem, and thank you to CommonAge for giving us African country chapters this opportunity. Greetings, colleagues. I know we're all in different time zones. For the South African presentation, I'm going to be co-chairing or co-presenting with my vice chair, Civil Lokotu, who is also the chief director in the Department of Social Development for Older Persons and has great wealth of experience in the older person sector. So we're going to just start with a brief introduction. It's been so interesting listening to everyone that's gone before me and seeing the common areas of challenges and priorities as well. And you're going to find there's a lot of overlap with my presentation. In terms of the aging population, South Africa is experiencing a rapidly aging population, with the number of older persons aged 60 and above increasing from 2002 at 3.3 million, which was 7.2% of the population, to 5.5 million, rising to 9.2% of the population in 2021. And according to the Stats South Africa's mid-year population estimates in 2025, this number rose to 6.6 million and is now sitting at 10.5% of the total population. So that's just to give you an idea of where we're sitting at in terms of a rapidly rising aging population. I'm going to now ask Civil to take you through the national policy framework. Civil?
Good afternoon, everyone. Good afternoon. Sincere apologies. Can everybody hear me? I was struggling to unmute.
Yes, we can hear you.
Can everybody hear me now?
We can hear you.
Oh, okay. Thank you very much. Let me start firstly by wishing everybody well for the year ahead of us, but also to appreciate, this opportunity and platform of engagement created by CommonAge It really grants us as countries an opportunity of networking and exchanging ideas. And I want to also, support what Carmen has just said, that there are a lot of similarities and trends that are cutting across what the various speakers have already said. Fem, let me also take this opportunity to wish you well and to congratulate you and acknowledge all the groundwork that you have laid for us as the South African chapter before you took on your new role, and we really wish you well. And we are definitely here to rally behind you and to support you. And Carmen, thank you very much. And I appreciate your leadership and the support that you are really granting, for the South African chapter. And I hope that we are off to greater heights with this approach that we have adopted. Let me just indicate and start on a very, high note by indicating that as a country, we have just recently received very good news that the president has signed our bill off. We now have the Older Persons Amendment Bill formally, enacted. We have a law that is going to be guiding us in terms of the provision of services to older persons, and we are quite excited. We will be embarking on a journey to the development of regulations that are going to be enabling us to really come up with a very strong and guiding, directives to assist us in terms of implementing all the sections of that legislation. So I think these are good news for us, and it really also, encourages all of us within the aging field to continue working hard. And I cannot also not say thank you to TAFTA. You have been part of the journey in very big ways. So thank you very much. And I take it that, our counterparts in other countries would also be joining us in celebrating this big milestone. That is about the Older Persons Amendment Bill. We have also, concluded all related processes as indicated in the presentation. When we last talked, we were busy with public engagements, we had hearings, we had engagements with structures of parliament, and all that is now behind us. We are now talking about regulation development. Side by side to that process, as a country, we thought it was necessary for us to respond to the need to come up with a national strategy on aging for South Africa, which is quite at a very, advanced stage. We are almost at the tail end of concluding on this important process. And this strategy has taken into consideration all our critical documentation, legislative imperatives that are linked to the Older Persons Amendment Bill at the time before its enactment. And we have also considered other critical policies that we have in our space to actually ensure that this national strategy on aging for South Africa really assists us to address some of the critical issues that we have not been able to really, firmly deal with. And to that effect, we are about to finalize this strategy. We have consolidated a national task team that's going to just assist us in terms of pulling the last few issues to that effect. We are working with our Chapter 9 institutions, as well as institutions of higher learning, to make sure that we do not leave anything behind, but we're bringing on board all other critical government departments as well, and stakeholders that are also critical in this space to conclude on this one. And in terms of supporting the legislative imperatives, specifically also the issue of the effective implementation of the Older Persons Amendment Bill, we have looked at the implementation evaluation of the Older Persons Amendment Act. And I think it has been quite beneficial because we were able to pick up on the areas of weakness. And to that effect, we have also brought on board the various heads of different government departments for their support and commitment in terms of executing some of the core mandates that pertain to their departments, to ensure that as a lead department, we are able to effectively, address all those areas of weakness. And we have successfully taken the implementation evaluation of the Older Persons Act through those structures, and we are on our way to Parliament in terms of presenting this outcome of the implementation evaluation, looking at the roles of various government departments so that they can all, effectively implement this with the support of their directors general. And that will also be supporting the National Strategy on Aging upon its approval. So the outcome of these three processes, which is the bill, the strategy, and the implementation evaluation, they are all going to be, well consolidated when once we conclude on this exercise. One of the key areas of weakness that we have, which I do know does impact on some of our challenges, is the issue of the protection of our older persons. I need to just indicate that it is indeed a worrying factor for us, because we've got a prevalence on issues of the violation of the rights of our older persons, regardless of the fact that we have developed a very progressive protocol on the management of elder abuse, which guides our practitioners on the ground in terms of how to manage, elder abuse issues, but also, the periods within which they need to react, processes and procedures to follow, how they should link with our justice system, and some of the primary things that they need to put in place in dealing with this. So we have an OPA system that is in place to deal with all these matters, and we're working with various government departments and NPOs to ensure that this matter receives the priority attention it deserves. And we also have the implementation of the 365 days of the active aging program, which is one of the things that the programs that we have in place, well supported by government, starting from national and going to provincial level, working with our NPOs and the South African Older Persons Forum to ensure that we keep our older persons away from the burden of diseases. So that is one of the key programs that really assist us in terms of addressing those issues. One of the things that I'm going to speak to last is the issue of the training on Alzheimer's and dementia-related diseases. We have been privileged to have been supported by Fulbright in terms of training through the initiatives of TAFTA. As government officials, we have been exposed to that training. And I need to indicate that some of the provinces have gone out in terms of rolling out, regardless of the massive responsibilities that all the processes that I've just indicated are receiving approval by various government structures and the sign of the legislation. Many of our officials have been, supporting these processes, and as a result, it has been quite a hectic period. But we have been able to, start rolling out the benefits of the Fulbright training. But we also had another, supporting program on the side, which government had initiated with NIGDEM, on the same issues of Alzheimer's and dementia, noting the increasing number of our older persons who are dementia and Alzheimer's sufferers due to issues of longevity and the burden of disease that is currently experienced. So sorry, I think maybe I need to pause there and hand.
Yeah, so sorry, we've got 1 minute left.
Sorry?
We've got 1 minute now. Yeah.
Oh, no, I'm done. Okay. I'm done.
Okay, I'm going to take over and dive into challenges. Some of our key challenges are poverty. According to Stats South Africa's social profile on older persons, approximately 50% of older persons live in households without any employed members. Dementia is also one of the urgent challenges, and we know that it is accelerating in prevalence. One of the things we find is that there is a lot of stigma attached to it, and research in South Africa has found that especially women who suffer from dementia tend to be ostracized or even subjected to attacks and sometimes even killed because of a lack of understanding about the behavior that's attached to dementia. Elder abuse is another major challenge. I'm not going to go into detail on that. Then just in terms of best practices, I'll go on to the next slide quickly. South Africa prides itself on having one of the best legislative frameworks the South African government's rollout of the old age grant to people 60 years and older is an important poverty alleviation strategy. And empirical evidence reveals that about 4.1 million older persons are actually benefiting from the old age grant. The Commonwealth Roadmap to Healthy Aging is a framework that the South African chapter is adopting and has been working with in partnership with some academic groups to initiate initiatives around dementia awareness, nutrition, and healthy aging. And the roadmap was launched at the Commonwealth Heads of Government meeting in Samoa in 2024. We also have gone into partnership, next slide please, with academic institutions in terms of the trainer program evaluation, and Civil has gone into some detail on that. And then we've also worked with academic institutions in terms of facilitating the implementation of roadmap initiatives. The chapter has also been involved in 2 academic publications in collaboration with University of Johannesburg and University of Mercy University in the USA with Dr. Reno. I'm not sure if I have any more time, Fem.
Your time is now. Let me give you 30 seconds.
Okay, Civil, you want to go through the innovative solutions?
Maybe what we can do is, can we share the slide with the
Sure.
participant? Okay, can we do that so that we just fair to the other participants as well? But Kamal, thank you so much, and Civil. I think the presentation highlights a lot around the policy architecture, and for countries that are wanting to move beyond policy towards the enactment, maybe something that you could reach out to the South African chapter in terms of budding up, let's understand what works, what doesn't work, so that we can move that forward. But also in terms of what are the practical rollout plans in terms of the roadmap, what are some of the initiatives we can engage in. So thank you to Civil and Kamal for the presentation. We now call on Anderson. Anderson is going to be presenting on the initiatives from Zambia. Welcome, Anderson.
Thank you so much. Thank you.
Hello.
Hello.
Anderson, yeah. Go ahead, Anderson.
Okay. Good morning, good afternoon, wherever you are getting me from. I'm actually going to present a paper titled The Zambian Aging Landscape, Policy, Action and Resilience. Next slide, please. Hello. Okay. On the introduction to Zambia and the demographic shift. Okay, from the heart of Southern Africa, I bring you greetings from Zambia. Well known for its copper and the might Victoria Falls, Zambia is experiencing a quieter yet profound transformation, the aging of its population. Like many nations, our life expectancy is gradually increasing. Currently, older persons age 60 plus constitute about 4.5% of our population, a figure projected to increase. Then we have on the national policy and the registration on aging. The Zambian government has a policy on aging, which was actually it's just in form of a bill. It hasn't been enacted. We are the government actually responsible for this, and it's actually doing everything possible to see to it that the paper goes through. Next slide, please. Okay, highlights of our work. As Alzheimer's disease and related dementia in Zambia, we are actually advocating for policies that will align with our work in our country, Zambia. As I earlier mentioned, we are capacity building. As you can see in the picture there, we are advocating for the rights of older persons. We're advocating for enactment of a bill on dementia and other things that to actually work for our organization and for our older person in line with the government policy. Next slide, please. The challenges experienced in aging in Zambia. We have urban migration. Many people are moving out of the villages, going to the cities. They are leaving elder persons in the village where poverty is very high. And this has led to a lot of suffering to our people in the villages, in the rural parts of the country. So we are actually, the government has rolled out social cash transfers to these people to help them. We have people aged 70 and above who are actually assisted by the government to actually be beneficiaries of the social cash transfers, which is actually transforming the lives of people in the rural parts of the country. Next slide, please. On best practices and innovation solutions, the government has some programs that is helping older persons through the same social cash transfers. Older persons are able to do income generating activities like farming, poultry, and other things. As you can see in the picture there, an older person with that nice garden, that older person can generate income through these activities. Next slide, please. Okay, the way forward and conclusion. With the partnership with CommonAge, there are a lot of things that we are learning from our colleagues across the CommonAge. There are trends that we need to emulate, trends that we need to incorporate. For example, we are working with the CommonAge. There are so many things that we are learning, and these are implementation of nutrition aging policy at a district level, advocate to dedicated funding for aging programs in the national budget, and so many things that we are doing with the help of our colleagues. Next slide, please. Thank you so much. This is what I have on Zambia. The rest you can read from the presentation. Thank you so much.
Thank you, Anderson. Oh my
Yes.
gosh, Anderson, you still have like 5 minutes to spare. Well done. We could have auctioned off your 5 minutes to one of the other presenters. But thank you so much for giving us a snapshot of aging within your context. You know, some of the challenges experienced. Again, the issue around urbanization is something you bring up, which is something we must speak about, but also the importance of farming, food security, cultivation. I was loving the gardens that you showed, but the importance of that, and also to get older people involved in these activities within the region. So thank you for your presentation. So we come to almost the close of our session, but I would like to extend my sincere thanks to all of the presenters. I've been watching the chat box. I don't see any specific questions, but I just want to say thank you to each of our presenters for the very thoughtful and real journeys into your respective countries. I think your inputs have given us an idea and brought to life the diversity of aging across our region, while also highlighting the many shared challenges, opportunities, and aspirations that serve to connect us. This platform was intentionally created to share, to identify points of synergy, and most importantly, to start conversations. And while we will be sharing the recording of today's webinar, I would strongly encourage you to collaborate beyond just the webinar. Sometimes it would be as simple as an email or a message just saying, I was really interested in what you presented. Can we chat further? Or let's explore working together on this. This is how momentum is built. And this is the whole point around today's webinar, to kickstart those conversations. So let us keep talking, keep connecting, and keep moving in the same direction towards an all-age-friendly Commonwealth. Please also consider inviting other colleagues in other countries to join our growing network. We have already seen interest from Rwanda. I see Ellie's here as well, as Uganda, Bale, he's here as well. And our collective ambition is clear. I would love to be able to see us have CommonAge chapters in at least 80% of the Commonwealth countries in Africa by the end of 2027. So there's 21 Commonwealth countries in Africa. 80% of that is about 17. I think that's doable. But I'm an optimist, so I'm thinking, let's see how we can move forward. With that shared purpose in mind, it's now my pleasure to hand over to Mansour Dalal for the closing remarks. Mansour, over to you.
Thanks, Femida. Wow, what a 90-minute kaleidoscope that we had of Africa. Amazing, amazing. I must say, Botswana, Megan, Kenya, Richard, and Margaret, from Mozambique, Miguel, from Namibia, Zanet, from South Africa, Carmel and Civil, and of course, Anderson from Zambia. It's been amazing. The amount of information that we could gather on this 90 minutes is immense. What of course stands out, as has also told by Femida, is that there are tremendous cross learnings that are available. There are opportunities for collaborations. There are challenges that we all have. In fact, when I was looking at the numbers, and I'm reminded of Indian numbers of 147 million seniors. And the challenges that we face is similar. The scale differs, that's all. And we also have the similar sort of an, workings and hopings for private government partnerships that everybody said. What I feel that could be done for Africa, of course, is something that we will need to discuss more, is I'm sure all this conversation will be collated, all the data will be collated. And if we could have some sort of an cross-learnings documentation prepared, common initiatives, there are some fantastic initiatives. I mean, Megan's Be Smart, Be Friends, Be Shape was amazing. And if those initiatives that can be, duplicated across countries, across the continent, that is, of Africa, and if we can come out with some sort of a commonality that we have, that we face, that I see a common thread in all the countries, then perhaps the evolution process of our reaching out to healthy aging, that is our milestone, could be done faster. This is the step. The first step is brilliantly taken. All congratulations to you, Femida, and to your team. You have done a wonderful start of the year, and there should be a common playbook if we can come up with, which would help us for two points that stand out. One is dementia and one is healthy aging. If we can come up with a common playbook for both of these, which would benefit across the continent and resonate with the individual and the and cultural ethnicity of that countries, it would be brilliant. Thank you once again for calling me over, and it was really a really wonderful and eye-opener. Thank you, friends.
Thank you. Thank you, Mansour. Andrew, can I invite you to say would you like to say a few words? I also want to acknowledge the other board members who are on the call. Anne Keeling, thank you for joining as well. I know Andrew said he's traveling, so I don't want to put him on the spot.
No. Hang on. Nothing like being put on the spot while I'm driving, but I have pulled over, you'll be pleased to know.
Okay, good.
But Femida and everybody, it's been really interesting. I have been doing other things as well, multitasking today, but fantastic presentations. And as Mansour has said, there is so much common ground that we share. And it is really heartwarming to see how CommonAge is reaching out, extending its reach. We're still a young organization, but we have big ambitions. We are just run by a bunch of volunteers. but that group of volunteers is expanding as we speak. Our dream that we share is that every country in the Commonwealth should have a healthy aging plan. The roadmap is the way to get there. We are working with some countries where we are trying to develop a way to deliver that. We want to be talking with governments about how we do so. And the work that you are all doing is extraordinary. It was my privilege last in November to be able to travel to Rwanda and to Kenya and met with our colleagues in both those countries. I've touched into Namibia, I've been to South Africa and seen the great work that you do at TAFTA. And so I just want to thank you for a fantastic webinar. As Mansour says, a great start to 2026. And let us help you achieve your ambition of getting 80% of the countries in Africa on board. Thank you very much indeed. I'll leave it there.
Okay, thank you, Andrew. Thanks so much. And now to just round off, I see Anne as well. Anne, would you like to say a few words? So Anne is a fellow board member.
Yeah, just very briefly. I think Andrew and Mansour have said everything, but it's been so inspiring to hear the work that colleagues are doing. And I think that although we face common challenges across the region, but to some extent also across the world, the challenges that you're facing in Africa in terms of health systems, in terms of poverty, in terms of humanitarian disasters, those are in a sense at one end of the spectrum, and so there is so much work to be done within the Commonwealth. And I think when we're talking at a Commonwealth level about aging and healthy aging, it's really, really important for us to be representing the whole spectrum of people's experience. But yeah, thank you so much for the work that you are doing. It's absolutely astounding. Thank you.
Thank you. Thank you. And on that note, I'm going to just give Iris a chance to say the final words so that she can direct you as to how we can connect via our website, socials, whatever. Iris, I will hand over to you. Iris handles all of our media and publicity at CommonAge.
Hi, everyone. It's so great to see so many of you joining us from across the world. So inspirational. Thank you to all our speakers. And yes, just from my side, we'd love to connect further. We'd love for you to see all of the developments from across the Commonwealth. So please connect with us on LinkedIn, on Facebook. I've put in the links into the chat as well as our website link. And please send us a note if you want to join us as a member, a paid member, or an individual. We'd love to talk some more. So please join the family. Thank you so much. Thanks, Fem.
Thanks, Iris. And last is Renita. Renita is the person who emails and is behind the scenes getting everything done. So Renita, you've just been super fantastic. I must acknowledge all of the effort you've put in as well. And thank you for your support. Well done, Renita.
Thank you.
On that note, well done to all the participants. You guys have stayed until the end. I'm so impressed. But it also tells me how important this kind of conversation is. I'm hoping that we'll have another webinar soon and we'll see you joining again. Okay, thank you, everyone. Have a lovely afternoon. Bye now.